Welcome back to Daktari, a quick one where we're hosting the wonderful, very interesting story, Dr. Mbaruku. Doc, sasa wewe umetuambia hapa postgrad umeenjoy life, umereceive vizuri pale MTRH. Wewe ni first orthopedic female surgeon, watu wanakuangalia vile wow. Then you come to practice back to the city of the sun. How is it? Said you got back to private practice?
Yeah, I got back into private practice. So I was barely cushioned by a Gava fallback.
Barely
I only
cushioned.
did, barely cushioned.
What does that
Because
mean?
I did, you have to get your specialist recognition license, you have to do an attachment with a government institution.
Oh, it has to be a government
Yes,
institution?
it has to be.
Oh.
Yeah,
Okay.
because that's where they station an orthopedic surgeon, isn't it? So, yeah, so they're absolutely certain that you will get the work and you will do it in that. So I got that exposure, for a bit. And then after that, there was, no space to absorb me.
So it's usually 2 years.
Yes.
You need to practice for 2 years.
Yeah. Actually, it is, isn't it?
It is.
Yeah.
What do you mean it is? Well, how long did you do it?
Let's say 2 years. I don't know.
So that's
actually,
in Jaramogi?
Yeah.
So you're acting
because
under
I applied for it after 2 years.
the now
Specialist
special
recognition.
recognition.
Yeah.
Okay. So you came back. You said you went private practice.
Yeah, I went to private practice, working under my colleagues in their practice. Yani nilishikiliwa tu kwa mkono because Aga Khan let go of me.
Aga Khan
which took me to school let go of me.
Aga Khan took you to school.
Yeah.
They sponsored you.
They sponsored me for school. I said that
That's
I
nice.
trained for medicine and I went to school in a good era.
Yeah, I mean, Aga Khan sponsoring you outside Aga Khan.
They did.
Oh, so huku safa. Sasa huku safa sana.
Sikusafa sana. Suffering ilianza after.
Really? Tell me about it. What happened? So why are they letting you go na wamekupeleka shule? I thought they would be the first to say, come back our child.
Yeah, to be honest, I mean, sometimes we just have confusion. I mean, yes, I had very good reception in my postgraduate training. But when it comes to the ground now, you're dealing with big patients and you're dealing with money and so it is just the way. I think that's what I have to say.
Wait, you're dealing with real patients, real money. What do you mean real money?
Real money. In training, you're not a threat to anybody, are you?
I see where you're headed.
You're not a threat to anybody. You're a human resource that can be used and abused.
But so are you, more or less, in a public setup. Well, you earn a salary that is fixed at the end of the.
No salary.
But you went because you went to private practice.
Yeah, I had no salary. I came out of postgraduate into a no salary job.
So you had no job.
I had no job. I had no job. None. I met a salary.
Oh. So how are you surviving? What do you mean have no salary? You're mentioning competition, you're mentioning money wars.
Yeah. I was at the mercies of my colleagues who were very gracious to allow me to operate with them in their private cases outside the hospital, And so when they would get paid, they would pay me partially.
You were not doing independent cases?
No. I didn't have a name.
Oh, you have to build a name.
You have to build a name. Everything takes time. I had to build a name. So I worked in their clinics with them, under them, for a while. But for me, I couldn't continue doing that. By I think maybe April or something, 2016.
Mm-hmm.
A colleague of mine had rented an office, wanted to do something with it, and then offered for me to go and see patients there.
Oh, like now your office, like,
Yeah. Told me, okay, yeah, I'm gonna do
see patients, yeah.
see patients here.
Mm-hmm.
And then I didn't have office furniture, and a colleague of mine from Eldoret, a big brother, but Dama, give me, something to start my office.
Oh, akaku. Did you ever think now sasa umerudi Kisumu where you love apparently because of the sunset, but you trained in Eldoret.
Yeah.
Did you ever think maybe you had better connections there? Maybe your life would be easier there?
I probably did, but I had left Kisumu knowing that I was coming back. I knew that I was coming back to the camp, and as I told you, when I left internship, I was following love and a family beginning. So even
Which
as
were
I
in
left,
Kisumu
I had left. Yes, I had left, and with the promise to come back because I still wanted to start my family, over here. Well, I have to start it.
By the time you're going, that started.
So I was coming back. Yeah, because this was where we had said that we were supposed to start.
Oh, you had decided. You had made a promise.
Remember, I had made up for 9 years before.
So ukakuja huku kwa hii jua ya Kisumu. Na jua inakuramba ukweli. Unajua kuna jua ya weather na kuna jua ya mfuko. Juu sasa kama una wera mazee. So how did you survive?
That was very wild. So I would operate with senior consultants, and if they were paying cash, they'd give me maybe like 30%.
Like wanakulipa like the way they pay anesthetic.
Yeah. Of their amount.
But at this time, I'm thinking you can do operations independently, can you? Yeah.
And maybe I've done them also, but if the procedure was in the name of the
ni yake, patient ni wake. People are owning patients.
Then yes, I could do the
Yeah. So yeah. So you have to build your own name, create your own pool of patients and stuff. And so that took time.
That's where, after sitting also I was working with this surgeon, I was seeing patients in this surgeon's office. Then at some point I was just like, no, this can't work. This can't. I have to move. I have to get myself in.
You did.
So now that's I have to start doing
and you did.
I did.
So that's over the 9 years you built yourself a bit of a name. And how is it? How is it? I mean, you mentioned that back in the University of Vienna, the reason you didn't go there, your mentor felt that there would be a male what? Make a male something. Chauvinism. Yeah, and it is there. I mean, it is there. Even kwa grao, there's a joke that one of my favorite comedians says that I do not oppose when saying that a woman is a mechanic. Let her be a mechanic and I support her. But I also want my car to run well. so she can be a mechanic, but I also want my car to run well. Yeah. So I'll take it to a male. Yeah. Have you felt, has that happened?
Yeah, it's happened many times.
Many times?
It has happened many times. It's just the way the world runs because, society has always been patriarchal. Look at the two runners for the AUC.
Is it because the society is patriarchal, or is it because those are the ones who presented themselves? Amina ran last time. Amina Mohammed ran last time, and we laughed at her for not getting it. I hope we don't. Yeah. By the time this show is airing, Baba will have either won or lost. So it's tomorrow. Is it tomorrow? Yeah.
Anyway, so it has happened, but you also get out here and you talk and you find out that patients still hop around, even if they see male doctors, still will hop around. And if they're shopping for something. So it depends on what condition it is. Some patients might also view as, yeah, and so this male doctor or female doctor, patients are, they're completely.
So this is patient's preference.
Yeah.
So you have patients who prefer.
Yeah, they can be more attracted to Dr. ABC because they feel that this one seems to understand, right this way, things like that. Personality feels like this one might be more authoritative this way, and
I've seen that.
to different doctors for different things. Yeah, their relationship is different, So I'd say that a lot of sheltering happens within public hospitals where you don't do your surgery.
Yes. Huko ukiambiwa ni huyo. Wait, so in the private the patients get to choose?
Yeah, they go to your clinic because they like the service. Or there's no place.
They've been referred. What about referral? Because as a consultant, you get maybe referral.
I get lots of referrals. I get lots of referrals.
Yeah.
Your referrals are cherished.
Mine too. Wait, and this chauvinism, so to speak, have you experienced it among colleagues, maybe?
Not directly. Maybe indirectly.
Indirect? What do you mean?
Somebody can have a slight remark. That was many years ago.
Many years ago.
Slight remark.
She's an orthopedic surgeon. I mean,
Coming to our
she's exactly.
and
that's.
is not where I practice.
Yeah.
Where I trained is not where
So
I practice.
I understand. Even me, I've experienced that. And whenever you go to some place new, it's sort of people are always wanakupimia kwanza. They want to see what you really can do. People always wanakubeba ndogo, and then you sort of have to prove yourself.
Yeah.
I don't know. So,
So I did have to prove myself. I did have to prove myself to my colleagues, prove myself to hospital staff. The colleague, this is not even the certification. Because your accreditation is there.
You're the same, you have the same qualification.
Yeah. You did it. First exam, the first exam. You went through a thesis, you went through a thesis. That's it. So here, amongst colleagues, they're equal, So unless people who have been in a different system or not have interacted with, there's nobody who
Hakuna ati superiority or anything.
The difficult people to convince, the more difficult people to convince are the people who are under you.
Under you?
Yeah.
Theater techs, scrub nurses.
I've never seen a female orthopedic surgeon. So you have to So
umezoea Nyakinda huko.
Umezoea a big man going to government, handle things this way, So that's what you're used to. So when you see
a lady, when your nurse leo? Sister.
You can get a bit of that. So when you now meet this person, your expectations are changed.
Yeah.
So then you prove yourself in how you handle, how you do procedures, how you take care of this. Then now
do you think the bar is a bit higher for you as a female surgeon than as a male? Is it true? Because mimi naangalianga the world of today, And I think females are more favored than males when it comes to education opportunities, job opportunities. If I go for a job interview with a lady, if it's just not a very straightforward thing, it's more of human based, human preference, which most are. The female has a higher chance of getting it than I do. Not because she can talk, because she's female. Yeah. Have you? Do you think it's harder for you in the surgical field to maneuver, talk about patients?
No, no, no. I mean, now the practicality of the situation is not quite,
Mm,
um, because some of these things, it depends on how aggressive you are. Like,
mm,
going out there and getting your work done.
mm,
So you can come with a lot of zest and get a lot of cases or things like that.
mm,
The rest of the way out, and maybe you can get more. But you have people who are um, not as aggressive. Mhm. If you're a female,
mm.
it might not work. Yeah.
Because you're not as aggressive.
Maybe you have a gentler way of
Yeah.
so people overlook it.
Mm,
Either be as the reverse for men,
mm,
out there. We, yeah. For me, like by the time and as I grow into the profession, even now I have more discussions with the patients. I have longer
mm,
longer sessions with them to tell them if it's that we are doing a procedure, why we are doing this procedure.
you explain.
Yeah, explain it and explain to them that this and this can happen as a complication of this because I have seen it for myself, and I can tell them now from my experience this thing has nothing. So and I may tell you a whole lot of things that may make you think that I'm not confident in conducting a procedure. For me, I'm just making sure that you're well informed about what it is that you're going to do.
Informed consent.
Informed consent.
Yeah.
We have discussed this, we have said this. So that even by the time we're having the procedure, but you remember that we had discussed that we had discussed that you would feel pain this way and this way, that you're going to be this amount of duration before you can walk. You remember the patient noticed this. Yeah. And so you wind up taking a lot more time. So I've had situations and places where they said, Neema is slow. But Neema is slow intentionally. I'll be intentional about what it is that I'm cutting and how it is that I'm cutting, how I'm approaching this. And I'll be thinking very many things. How can I avoid
complications,
more harm? Yeah, because how we are created, we're created seamless. I'm just about to make a seam.
Yeah. The seam has to be as seamless as possible.
Yeah. So can the seam be as seamless as possible? Can the seam, can everything have a little bit? So there are some of those moments that I have felt underdone because of something.
I've heard of a story, and this story has made me really want to have a female surgeon on board in this program, because this I had and I was like, what? That can happen? Because a colleague of yours, you won't name names, said to me that sometimes you, even as in the maybe in a city or a town, you have your patients, but maybe booked in a private hospital. You go on a break, or you're away for a few days. You booked to do the case on Tuesday. You come back and it was done yesterday on Monday by another a male doctor, specifically because this was a female surgeon. So the feeling was that this is happening to me because I am a female doctor. Have you experienced that?
People do that even amongst you doctors. The patient are coming at night. Yeah? That patient, if you don't operate on them that night,
they'll be gone.
They'll be gone. They'll be operated on by somebody else. I think that has happened in other towns. That has happened to them.
So you don't think it's a gender thing?
I don't really say. I think it's more of a competitive thing.
Uh-huh.
So my practice has taken a more elective route
Okay.
versus a more trauma
Trauma.
oriented. And so it has had a slow approach where I have started the patient is well
You
vaccinated.
followed up the patient a
Followed up
couple
the
of
patient, yes,
times
exactly.
before.
And so by the time that we are doing the patient is sold
Mm.
that Dr.
Will do it because she has been my doctor.
Exactly. So my procedure, my practice with time has taken
An elective route.
route.
Speaking of elective route, do you have plans like for specialization, sub-specialization that is?
I did an orthopedics and spine fellowship in 2017.
27. This is like just 1 year after.
Yeah.
Ah.
Actually, that was the one time we were allowed to do those things. It was in a hospital in Germany, Munich.
Oh, you went to Munich.
I went to Munich.
Did you go to the Bernabeu?
Did I go to?
To the stadium?
Oh no. No. I just heard about it.
So
probably one night somebody pointed there and I was like, oh yeah,
it's a very beautiful stadium. It's very pretty.
Yeah.
You didn't go?
Imagine. Like you got to one day, I think in passing, like in traffic or something, somebody was dropping me off in the evening. Point.
Anyway, so you did arthroscopy and spine surgery. So you are just arthroplasty and spine. So that's your subspecialty.
Yes. That was my subspecialty. That was what I was.
I feel like there's a bat. Is there a bat?
Yeah, there is a bat.
Yeah.
But now I don't know whether, everybody does primary needs and primary hip. Now I consider now that as part
the arthroscope. Wait, what do you mean by primary?
Like like for you because you not have any. Then that would be like a primary need to do that.
Okay. That's a primary.
So revision surgery now
the harder one.
Subspecialization.
Now everybody does it,
yes,
right?
exactly. And now even with time, if maybe more people will catch up with revision. Because now people also want to do revision surgery because they are now the primaries that have been done. The population still doesn't have as many joint replacements as you would say, like what I was saying.
That's
because
a lot.
we were doing like eight replacements, 8 joint replacements in a day.
But the population is more aging, right?
It's more an aging population. Still had some young patients who had other issues having primary replacements. But we would do those. So that was there. Now knee replacement, hip replacement. More like I'd say that everybody comes on train because they have more arthroplasty. But I have loved doing degenerative spine conditions. So I've been doing a lot of laminectomy, compression. I did a lot of those.
So you're a spine surgeon.
Yeah, I enjoy.
You enjoy spine surgery. Hand, foot, and ankle. Yeah, he told me it does hand as well and foot.
It's a long journey. So long as we're given life,
you can always change. That's the beauty of medicine.
Yeah, because there are people I know now, who have been mature and then started doing spine, orthopedics or whatever. They're 50s and 60s.
Amazing. So you teach and you do private practice.
Yeah.
How's teaching?
Teaching is good. I think you can do better for teaching.
We definitely can.
I think we can do better.
Yeah.
I think we can always do better.
That's a topic for another day, but I think we can. You
Yeah.
keep mentioning family, and I wouldn't want to let you go without you telling us about family. How is the balance? Because I was telling about Dr. Florence, right? Dr. Florence, she calls herself Dr. Mrs. Mom. She quit medicine entirely to just focus on raising a family.
Wow.
Yeah, focus on, as she says, she wants her husband to come home to a happy child in a well-prepared home.
Wow.
Yeah. So,
Wow. Bless her.
bless her. I was shocked. I was like, what? Yeah. How is family for you? How's the balance?
Sugar rhymes.
The rhymes. Sounds like a name I know.
Yeah, you do know. It's sugar rhymes. Scandal. The record Scandal.
Oh, Scandal, the Olivia Pope thing.
Yeah. So it's director with Oprah or something. She talks about succeeding a man and failing. Cannot do both at the same time. She's succeeding as a mom. She's failing as a career person. Because they're technically mobile. For me, I don't have the luxury of having a husband to go home to take care of.
Or to come home to you.
Yeah. You don't have that luxury, whatever that relationship is. So, as a single mother of a child, I have to put my best
foot forward
in terms of working, providing, and spending the time that I can
with your daughter.
If I spend a lot of time following her on her everything, I miss out on work. So a lot of my responsibilities as a mom are delegated to people who help me. Our people at home who help us. And our home is also a business ground.
Business ground?
A business ground. We run a lodge that we are constructing.
Yes,
we're in hospitality. So
by we is you, your daughter?
Me and my daughter, yes. And the people who work for us.
Well, you said you came to Kisumu because of a fiance. What happened to them?
Oh, yeah. Well, we got married, and then after we got married after coming to Kisumu a year, and then we got divorced after postgraduate.
Was this because you had spent your 4 years
I don't know.
away?
I don't know what the truth was. I don't know what the truth is. I don't know why. I don't know why. I don't. He
would know better.
Yeah, he would know better, and he would be the one who's gonna face to tell his story. Yeah. So my story, my side is very blind. So let him say.
Tutamtafuta atueleze.
Yeah.
So, you said you have a lounge. A lodge.
Yes,
A lodge.
Yes, I came to my telling the books.
What's the name of the lodge?
It's called Heart, Palms, and Memories. Hearts.
Mioyo.
Mioyo, palms, palm tree.
Oh, sio mikono. Okay. And memories.
Yeah.
It's in Kisumu.
Yes. Kisumu was really rhyme.
Yeah. So, like you, it's a holiday resort?
Yeah. This is centered around maybe family.
So families come chill?
Yeah.
Ni Valentine's, tulete watu.
Hiyo pia ni family.
Valentine's, hiyo ni family?
Hiyo ni family.
Mtu wako? Anaweza kuwa mtemporary. Mpoa mtemporary. Mpoa passing by. Family. Hey, family. Anyway,
Yeah.
also you do that on the that's like
Yes,
your
yes,
side
that's,
hustle.
yes, yes. That's why I
Mm.
keep busy on the weekend.
Mm.
So we have that. So that's where our family um, business is,
Mm.
and that we have people there to help me, with the support that I need for my
For
child.
your child.
So
Mm.
unlike my preciously gifted colleagues who could get home and cook a meal for their family, whatever,
Husbands.
husband, I cannot do that. I just can't do that
Because
because we drive 45 to 50 minutes every day, and a bit of that is on a rough stretch of getting back home.
so you're
After
tired.
a long day, we are tired.
Mm.
We are dehydrated from the sun.
Mm.
We have homework to do, and so the homework I might help you by extension.
Mm.
And so mine is really restricted to the amount of interaction time that I have. Picking up and dropping my child
in school.
So that's the most intentional time that we have together. When we come back, she's tired, maybe she wants to run around. We have space where she can run and talk to the pets, carry the kitten back to her room and hide it And for me now, that's also the time when I want to recapitulate and think, oh, Dr. Nyadimu,
we have a podcast.
So now I think, decode, So my contact time with her is intentional about the amount of time that we spend. And so that is my family. She's 7 years and now 8 months. So she'll be turning 8 soon. So work-life balance. On the weekends, we are working, we are hosting, but we are working, and we like it. We love it, and then we can get to do other things.
Amazing. Daktari, it's amazing having you, but I want to touch on two things before I let you go. Just two things. Number one is maneno ni yetu si tatu kama ya yule jamaa wa ahadi. Number one, mental health. How is your mental health as a doctor? Now, a single mom doctor, orthopedic surgeon in competition with male doctors. How do you handle all that? Because, and I'll bring you to a sad story that I have experience of being in it, but I heard about it. Happened a few months before I joined where I work. There was an orthopedic surgeon female. Her name was Dr. Mercy. She experienced a lot of mental health issues and ended tragically. I don't know. How is yours, and how would you advise these young colleagues of ours who medicine is hard. Being a doctor is not easy. It takes a fight, a struggle. To even get the space now there's even competition.
There's so much intentionality about the mental health. I would say mine is good, and I'm grateful. I'm so grateful for it, but it doesn't mean that it doesn't get tested. Let's give like the current economic times that we are in. We have SHA issues. We have MAKL issues. We have hospitals that have locked you out of where you can practice and what you can or cannot do. And then you have outstanding payment bills. And so you have costs. And I can tell you that this is so trying for all of us. And sometimes I wonder whether some of us experience it. And so, you have loans to pay. You have
businesses to run.
Child
to raise. The child.
Salaries to pay.
Children to raise.
So I think that it's absolutely crazy how we have to navigate through this, and so these challenges can push you into things. negative thinking, alcohol consumption, drugs,
depression and stuff.
yeah, and poor relationships, a toxic relationship. So, protect that space. Some people do different things, but for me, I think the best is to distract that pain by doing something else that is building. That's not destructive.
Not destructive.
Yeah. Keep off the drugs. Keep off the weed. And I know this is amongst the younger doctors.
Yeah.
Keep off the weed. Don't do the weed.
Specifically,
don't do the weed. With the older ones,
the alcohol.
Keep off the alcohol.
But there are some who even do these more things in the hospital, the ketamines.
Keep off the drugs.
It's that bad.
There's exercise to do. And the best things in life are free. You can be up and there.
Yeah.
It's free.
Ketamine expert.
Yeah.
Yeah.
You get time for a minute.
And you need more.
Write. Read. Join your religious organization in its charity event.
Just the charity events. Okay.
Help other people do things. There are ways that you can actually be creative without spending money. There are ways that you can give service without spending. Because this is the biggest challenge. After whatever, money is a big issue. Money is a big issue for all of us. Once you have money, you think you have everything,
but it's not.
But the poverty and the money can also have the same problem.
You can be poor and depressed, poor and other things, poor in a bad relationship.
Yeah, exactly.
Rich
in a bad relationship, rich and an alcoholic, rich and destructive. So
find things to
do that can build you, and the best way to build you is by building others.
Hallelujah. That's powerful. That
others.
Is powerful.
Invest in others. Invest in others. I think that's it.
Thank you for that advice. Now, ya mwisho. Maneno ni mawili. Ya mwisho. Tukifunga. Tell us about Kenya Orthopedic Association. We have a conference in May. I attended the last one. It was nice.
So that is our annual scientific conference. Conference. That is a conglomeration of all orthopedic surgeons.
And ortho enthusiasts.
Yes.
Like me.
A confluence. The quality of our conferences has been improved so much in the past 8 or so years. The papers that people are bringing out, the amount of that same research that we're talking about. But the amount of work that people are putting into these things, the interactions, the social interactions that we get from the meetings, are
they're beautiful.
They're amazing. They're things to change. I would encourage that we participate. We have a website, KOA. Just Google KOA, then you find us.
Are you in the leadership of
Yes, now I am. I have been a treasurer.
Wewe ndio uko na pesa.
Nilikuwa.
Ulikuwa?
Nilikuwa treasurer 2 consecutive terms. That was fantastic. I'm a member of we have a special development, special purpose vehicle, SPV, as we work towards building the Kenya Orthopedic Association Institute. So we've got big things also for orthopedics coming up. I'm very proud to be affiliated with the association. I can't tell you how joyous it made us in the last tenure where we managed to buy land and we managed to get things. We had a very good chairman. who was, very bullish in getting things done, and we gave him the support. He had the rest of his office bearers were female. So we did well for Kenya Orthopedic Association.
Okay, all right.
I think we did very well. Our vice chair was Paris Wediru. I was a treasurer, and our secretary then was Dorcas. So can you imagine? We moved from zero
to all those. How many are you
to
now?
having a full office of
How many?
leadership.
How many orthopedic surgeons are
Oh,
there?
we're more than 30 now.
Amazing.
The female orthopedic surgeons should be more than 30 now.
Now, to these younger colleagues, my friends, these my friends who are my fans, Lindy, the the beautiful long nail doctors out there. Would you encourage them to be orthopedic surgeons?
Long nails, long nails, and you can see what mine looks like.
Isn't it orthopedic surgeon?
Gloves.
So, would you?
Yeah, I mean, if you have your designated days when you're going to be operating and you want to slip on those nails, even if it's going to be for a couple of hours, I've always wondered whether people stickers. The other day I saw somebody with a butterfly, and then she had nails. I really admire yani yangu inaisha tu hapo.
Weka. Itararua glass
lakini. Ilikuwa ya Sunday. But orthopedics, you have to manipulate an instrument. Yeah. Okay? And sometimes you have to handle that bone when you're maneuvering it. And sometimes that clamp is not clamping, the clamp, and literally, I mean, ours is not the mini is not meaning. Ours is literally
the clamp is not clamping. So you have to dig
so you
in.
actually have to give it the clamp effect yourself with your hands. That comes out. Good point in it. It cannot. It cannot because the grip as you're gripping that with the gloves.
Yeah. Itararuka. Clamp. Drill makucha. Drill your nail to the bone.
No, you know how to drilling it out. You have to.
But if the nail is too long,
but it's just
it's
probably not the most conducive atmosphere for you to do that. And then also when you want to tell whether a glove has leaked or whatever,
you can't.
Then
so apart from the nails
and then getting the stains into that, I can't tell you the number of things that discourage nail production in orthopedics. Other than that, orthopedics is about skill. Okay, it's technique.
It's your muscles.
It's not entirely about muscle. There's instruments to be able to assist you with the retraction, and there are instruments that will be able to assist you with holding bone in position. So it is not necessarily for a butch personality. As you can see, I think I still wear my lipstick. I still have heels on.
You're still a girl, Toto.
I'm still a girl, Toto. The only thing that I cannot do is nails. Yeah, because the hands just demand that the hands
be used
properly. But in terms of, would I encourage more? Yeah, that's why I got.
Walifungua milango.
This is the reason why I got. Oh yes, I did mention it. I said it's enough. And so this is the reason why I got into it. And so I will still sell that orthopedics is that you want to do it, come. We're here.
Hallelujah. That is it from us at Daktari, a quick one. Dr. Neema Mbaruku, it's been amazing.
Thank you.
Do come back again.
Asante.
Adios.